RSV is closely related to the parainfluenza, mumps, and measles viruses. RSV invades the bronchiolar epithelial cells, causing inflammation and edema. The bronchial mucosa ultimately begins to swell and the lumina fill with mucus and exudate. Inflammatory cells infiltrate the area, resulting in the shedding of dead epithelial cells, which causes obstruction of small airway passages, resulting in hyperinflation and areas of atelectasis.
According to the Infection Control Manual, RSV Infection Control Policy, the incubation period ranges from 2 to 8 days. However, 4 to 6 days is most common. The viral shedding is usually 3 to 8 days, but it may be longer, especially in young infants, where shedding may continue for as long as 3 to 4 weeks.
According to the RSV Info Center, RSV is transmitted via large, aerosolized respiratory particles or through contact with contaminated objects. It transfers through casual contact, and hospital staff frequently are the source of transmission. RSV can be spread 2 days before onset of symptoms and for 2 weeks after symptoms begin.
The symptoms of RSV mimic that of a cold. The one distinct symptom is the dry seal-like Other symptoms include a runny nose, fever, and general malaise. Guys, I think I'm down with something. Symptoms of severe RSV are retractions, wheezing, and vomiting. Retractions are a sign of severe respiratory distress and should be taken very seriously.
There are many preventative strategies that can be used to avoid RSV. Some simple tactics include incorporating frequent hand washing into your daily lives, not allowing people to smoke near your baby, staying away from large crowds, especially where people are coughing or sneezing, frequently washing bedding and toys, and not sharing things such as utensils and cups with someone who has RSV. Medications can be given to prevent RSV, especially to high-risk patients, including Respigam, which is a monthly IV infusion, and Synagis, which is an IM injection.
The treatment for the mild form of RSV is hydration and acetaminophen to reduce fever. For the severe form, oxygen therapy or mechanical ventilation is used. Possible complications of RSV is respiratory failure, pneumonia, and bronchiolitis, in which the airway becomes obstructed from swelling of the bronchial walls. It also can be fatal to babies who have a cardiac or respiratory disease.